Good evening. I'm Velshi, picking up MSNBC's continuing special coverage of the coronavirus pandemic. In normal times, millions of Americans would be hitting the road this weekend to mark the unofficial start of summer. But for the first time in 20 years, AAA didn't release data ahead of Memorial Day. Instead, they're estimating that travel will be the lowest in modern history for Memorial Day weekend. It comes as the United States closes in on 100,000 coronavirus-related deaths. That staggering number illustrated on the front page of tomorrow's New York Times, along with the names of those who have been lost to this pandemic. And while states across the country are starting to slowly reopen, the president continues to try to speed things up.
I'm identifying houses of worship, churches, synagogue, and mosques as essential places that provide essential services. Some governors have deemed liquor stores and abortion clinics as essential, but have left out churches and other houses of worship. It's not right. So I'm correcting this injustice and calling houses of worship essential.
There are, of course, questions over the president's authority to issue such a decree, but regardless, his insistence on a rushed reopening flies in the face of what public health officials continue to advise. And today, Trump decided to go golfing for the first time in 75 days at his private club in Virginia, as millions of Americans remain fearful about the next steps amid this pandemic. A poll released earlier this week shows an astounding 83% are at least somewhat concerned that lifting restrictions in their area will lead to additional infections. Joining me now, Andy Slavitt, the former acting administrator at the Centers for Medicare and Medicaid Services, and Dr. Lipi Roy, an internal medicine physician and an MSNBC medical contributor. Thanks to both of you for being here. Andy, you are involved in an effort to sort of figure out how to open the country safely, and you've got criteria that you and other professionals who have been involved in public health have worked on. Where are we in terms of meeting criteria for opening safely as opposed to opening up because there's public pressure to do so?
Well, I think all the governors are feeling public pressure to open probably a little more readily than they're quite ready. In a perfect world, we would have more testing capability. We'd have contact tracing capabilities. We wouldn't be preventing all cases, but we would be sure that when there was a case, we would have the ability to track it down and limit it. As it is, we are sitting today, somewhere between 20 and 24 states, Alabama, Texas, mostly in the South and the Midwest, are still seeing growth in cases that they can't control. Several areas don't have enough hospital room. As we open churches, and I think the president has it probably exactly backwards of things he should leave to the states and things that the federal government should do. I expect we'll be finding new hotspots too, and that's concerning.
Dr. Roy, let's talk about what you're seeing out there. We have right at the moment where we've got 100,000 deaths, this remarkable milestone that we're about to hit. There is a feeling amongst people that we're past the worst of it. The worst is behind us and we're on the downward slope. And that's hard to overcome when you see it around you. The evidence doesn't tell us we're in the clear yet.
Hey, Ali, and yeah, you're absolutely right. We're actually seeing different things in different locations. Again, it's like we're in 50 different little mini countries within the United States, and each geographic region is kind of doing their own thing. I think that we're seeing some consistency, but look, here in New York City, New York State, thankfully, the number of cases, hospitalizations, intubations, and deaths have all been decreasing after we went through a hellish period. Unfortunately, we're just not seeing that in other parts of the country, places where meatpacking plants and nursing homes and homeless shelters, prisons, jails, places where people are congregating either by nature because of the setting, like a prison, or because beaches and other parks simply have no stay-at-home kind of orders. So, yeah, and we already know that this is a virus that spreads through respiratory droplets. So if you don't maintain that physical distancing and the face covering, you're going to spread the virus. People are going to get sick. They're going to die. It's going to be a burden again on the healthcare system.
Andy, let's talk about some of the things that you and your group are talking about to open the country safely. A lot of this is stuff that should be obvious. Adequate diagnostic testing, which, again, is not available everywhere in the country. Improved safety standards to avoid outbreaks. Public health infrastructure to contact trace. Coordinated response with neighboring states. Sufficient personal protective equipment. And widespread use of telemedicine. The one that most interests me here is public health infrastructure to contact trace. Where are we in this country on that? We see a lot of ink spilled on contact tracing apps and some real shoe leather contact tracing, but do we have good infrastructure for figuring out when somebody gets this illness, where they got it from and who else they've been in touch with?
Well, so I think we're probably about 10% of the way to the infrastructure we need to really do contact tracing, and I'm talking about the shoe leather, the personnel. Put aside the technology and the apps. I think people have different attitudes about whether that can be helpful or whether that's an invasion of their privacy, but it's not the end-all, be-all answer. And thank you for pointing out, we did launch a website called open-safely.us. It has resources for everybody, for businesses, for states, and I think our point is that there's a silent majority of people who actually do want the country open. They just want to do it safely and stepwise. There are not people sitting around saying, gosh, I hope more people die from this, or I hope that our small businesses all struggle and close. To the contrary, we think most Americans are not at the fringe end, but really are telling governors, we want you to take it cautiously. We do want to open, but we want to open in a safe way. And if it takes you a week longer to do it right, we'd rather do that than have to go backwards and close down multiple times.
And in fact, Dr. Roy, there was a study that came out that indicated that if we had locked down a week earlier, that we might have saved 36,000 deaths in doing so. So this matter of days sometimes makes a big difference.
Yeah, it unfortunately does, particularly when you're dealing with a medical condition that's spread through infectious means. Remember, we didn't have a linear rise; we had an exponential rise, right? That goes back to that R naught, the transmission. If you spread to more than one person, it's going to rise exponentially, and so that's why even a couple of days, let alone 3-4 weeks, would make a tremendous difference. Again, if we acted much more expeditiously.
Dr. Roy, I want to ask you about something that you pay a lot of attention to, and I believe you've just written about, and that is we had an opioid crisis in this country going into it. We were starting to make some ground on that going into this coronavirus pandemic, but a lot of that is fed, some of that addiction is fed by despair. We now are a nation contending with anxiety and in many cases despair and mourning for the 100,000 dead, even if they're not people whom you know. This has been sort of a national catastrophe. What's your sense of how this affects opioid addictions?
Yeah, thanks, Ali, for raising this really important issue. You're absolutely right. Before the coronavirus pandemic, we had another epidemic, a drug overdose epidemic, which was mostly fueled by opioids. First prescription painkillers, then heroin, then fentanyl. And if you recall, Ali, it was making almost daily headlines in different parts of the country. And as you know, I'm an addiction medicine physician. And, using drugs is not something that's new, right? The opioid epidemic that preceded this current pandemic is not new. We as a people have been, consuming alcohol and various drugs, mostly recreationally. The small minority develop addiction. But you're absolutely right. Risk factors for developing unhealthy drug use that can lead to addiction include anxiety, depression, stress, isolation, loneliness. And unfortunately, the public health world has imposed this isolation as a public health measure, again, in order to keep people safe. But we really need to pay attention to people who are struggling with pre-existing drug addiction and those who are at risk for developing addiction. And, Andy talked about telemedicine in the rise of this epidemic. Well, we need to certainly increase the use of telemedicine, telepsych, to reach people who are struggling, who are now isolated from their addiction doctors and counselors, their group therapy. So we need to pay special attention to these men and women.
Andy, I mean, look, that may be the great thing that came out of this, because telemedicine's existed for a long time, but we always thought about it as a way to get doctors into remote areas or places that didn't have doctors. People were, generally speaking, reluctant to use it. It is a remarkably important cost-saving measure in a country that spends too much per capita on health care without the necessary outcomes, but it now seems to be something that the pandemic has broken the back of, and people will be more willing to use, both practitioners and patients.
I think you're exactly right, Ali. I think everybody that you talk to will tell you that their experience with telemedicine is actually surprisingly good. I believe it or not, I talked to a community clinic in Washington, D.C. the other day that has actually started doing children's dentistry over telemedicine. Now, how they do that, I don't know. But they said to me, if you'd have told us a month ago we would be taking care of kids and helping them take care of their teeth using telemedicine, we would have said, how could that even be possible? They say right. We now know we can keep a better handle on kids' dentistry than we ever could before. And so I do think this necessity is the mother of invention. People don't want to go back. They will find new strands. And I think it's not just in healthcare. I think people are renewing connections to people in their lives electronically through Zoom. They're finding other ways to connect with people, to be with their families. And I hopefully people will recognize some of the good out of that emerges here too, as you say.
Yeah, I think I Zoomed a total of like 5 times before this pandemic, and now it's a regular part of all of our lives with Facebook, with FaceTime, and with Skype, and with Teams. So, look, maybe something good comes of it. Thanks to both of you. Andy Slavitt is the former acting administrator of the Centers for Medicare and Medicaid Services. Dr. Lipi Roy is an internal medicine physician and an MSNBC medical contributor.